Hey everyone, my name is William Parthan Kieshler, and I've worked as a Vancouver firefighter for more than 10 years. As firefighters, not only do we put out fires, we respond to car accidents, and we provide medical aid to people in need. Today, I want to talk to you about what to do in the event of a medical emergency. The purpose of this talk is to empower you and give you some confidence that when something happens, you know how to help. There are 4 steps that you can take in any emergency. 1, make sure that the scene is safe. 2, call for help or send somebody for help. 3, take action if you can. And 4, don't worry, because more help is on the way. The first thing we want to talk about is scene safety, making sure that whatever happens, you're not going to be the next victim. Things to be careful for include down power lines if there's a car accident. Also, if somebody is hurt near the roadway, you got to be aware of the other cars. Make sure that you're off the road a safe distance. Another big hazard can be the waves from the ocean. If you can't swim, don't go in the water. This will just create another person who needs to be rescued. Call for help instead. Next, we want to talk about disease protection. If you're going to come into contact with anybody who's bleeding, like we said, the first thing we want to do is keep ourselves safe. So there's 2 ways you can do that. Use a medical glove or use a plastic bag. Hey everyone, we're going to talk about a technique called hands-only CPR. This is a basic technique that you can take if somebody is not breathing and their heart is stopped to save a life. It's only got a couple simple steps and we'll go over them now. First thing you do is make an assessment. Are you okay? Are you okay? If they don't respond, call for help or send somebody to call for help. You, call for help. Open the airway and look, listen, and feel for 10 seconds to see if they're breathing. Just look down here, you can put your hands here to see. He's not breathing. We're going to start CPR. The first thing we want to do is landmark where we're doing it. So it should be center of the chest, in between the nipples. I want to take the heel of my hand, put it right in the center of his chest. I can grip my other hand like so. And now I would start CPR. I'm going to push hard and push fast. I'm aiming to do this 100 to 120 times per minute. As I do this, the only time I really need to stop is if there's another person there and I get too tired and they can come in and take over. I want a full recoil of the chest. I'm pushing approximately 2 inches. You also notice that my hands, my elbows are pretty locked, and I'm actually using my body to push, the weight of my body. I want to do this until help arrives. Let's see that in a scenario.
Are you okay? Are you okay? He's not okay. Call for help. I'm going to check his breathing. He's not breathing. Starting CPR.
Okay. And you can see he's doing a great job here. He's in the center of the chest, between the nipples. He's getting full recoil on that chest. He's pushing about 2 inches, and he's pushing at a rate of about 100 to 120 beats per minute. That's what we're looking for. So one coaching point on delivering CPR is we want to use the strength of our body to help us. So what that looks like is you want to get as close to this person with your body as you can. So I've landmarked from his armpit to the middle of his chest or directly between the nipples. So when I'm here with the heel of my hand, I'm right over top of here, and I'm in an athletic stance. So when I'm like this, my arms are just slightly bent, but I'm using the weight of my body to do this motion, right? I'm not using my arms like this because I'll be way tired way quicker. And if I'm back here, there's a lot of wasted momentum here. So you just get right in there as close as you can, and you get in this position, and you basically let the movement come from your hips. Okay. When we talk about checking for breathing, universally in first aid, we talk about airway, breathing, circulation. So A is airway, B is breathing, C is circulation. So we need all three things to be alive. So all we're doing is checking these one at a time, and it's like a little checklist. So when we say airway, the first thing we want to do is give him a little head tilt chin lift to open his airway. So now that his airway is open, then I'm going to check for breathing. So I'm here, and I can be listening with my ear, but I'm also looking down his chest to see, and I can have my hand here. Is this rising? What's going on here? So this will give me the best view and way to assess for 10 seconds whether he's breathing or not. So if he's not breathing, then we're going to go to the next thing, circulation, and we're going to start CPR. But one thing we'll say is, say you're here, and this is especially true with somebody who's been drinking a lot of alcohol or been using drugs. There's times when you'll come here like this, and you'll say, "Are you okay? Are you okay?" And the person will not respond. So you call for help, go get help. So we go and get help there. And now I come here and I check for breathing, and I can see that they are breathing, but they're not responding. So what we want to do for people like this, as long as there was no physical trauma, no concern about a spine injury or anything like that, if they just were on the ground or they were close and we don't have any concern about that, we want to put them into what's called the recovery position. So the simple way to do that is you take the arm close to you and you put this up. Then you take the knee that's away from you, you lean that up, and then I take this hand, and very simply you just roll them towards you. And they'll be in this position here, and this position is a great position to maintain their airway. If they're breathing, this is going to be a better position for them to wait for help. Okay? Also, if they're going to throw up, they're already in a position where their airway will be clear. If they're lying flat on their back, there could be complications with throwing up, right? So that's the position that we want them to be in. Now we're going to talk about choking. The universal symbol for somebody who's choking is like this. So the first thing you want to do is approach them. Do it. Are you choking? Are you choking? If they're breathing partially, you come in and you give them 5 back blows. And I'm talking hard, between the shoulder blades right in the back. If that doesn't clear it, then we want to give them J thrusts. That involves taking your fist like this, using this part of your thumb, put that right in his belly button, and you're going to make a thrusting J upward thrust. I'm not going to do it too hard on him, but it looks like this. But be hard. Now, what's going to happen is something that they call, it's either going to pop or drop. So when you do those interventions, whatever he's choking on might come out right away. If for some reason it doesn't and he drops down, then we treat it, you can drop down. We're going to treat it the same way we would like we do with CPR, except when we open that airway, we want to look in their mouth because that's what was causing this. So we come here, we assess here. If he's not breathing, then we get on the chest. And we get on the chest, same like we did in CPR, but we're keeping an eye on his mouth to see if something comes out. The universal symbol for choking is this. And so we always start out, are you choking? Are you choking? And he said yes. So then we want to come in and help this person. So there's something we want to talk about, which is consent. If somebody is conscious, we always need to have their consent to help them. Do you want help? Yes, no. But there's something called implied consent. If a person is unconscious or unresponsive, then that's what we call implied consent, that somebody would want help if they're not able to verbalize that. So that's just a point that we like to say, that if somebody's conscious, we always ask them, hey, would you like help? Because if they say no, then that's okay. But if it's a real emergency or they're unconscious, then it goes to that implied consent where we want to help them. One other consideration, if the person is pregnant, we're not going to do the J thrusts ever. Instead, we're going to do chest thrusts. So you're going to come across here, put your fist in their chest, and make this noise like this. Okay? So that's the time when we don't use the J thrust, is on a pregnant person. Same rules apply actually to little children. We want to do the same principles, but the back blows, if the child is small enough or an infant, we can hold them in our hand and give them the back blows like this. Okay? One other consideration in choking. If somebody's choking, a lot of times it's their first reaction to run to the bathroom. But being alone is actually a really dangerous place because nobody could be there to help them. So if you're around somebody who starts choking and runs to the bathroom, make sure you run with them to make sure that they're okay. Let's see that in a scenario.
Are you choking? Are you choking? He's choking. Call for help. Back blows. Did it work? Did it work? Okay. J thrust.
That's the way to do it. Like we saw, he had his fist right in the guy's belly button and was making those J thrusts. That's how we want to do it. Nice. Let's see that in a scenario.
Are you okay? Are you okay? Call for help. We give 5 back blows. Are you okay now? J thrust.
And these are pretty good J thrusts. Just as a reminder, he's got his fist like this, and that's directly into his belly button, and he's making the motion just like the letter J. We want to remind everybody that if something comes out, that also we want to encourage them to go to the hospital to get checked out by a doctor. Let's see this in a scenario.
Are you okay? Are you okay? Not okay. Call for help. You do 5 back blows. Are you okay now? He's still not okay. We start with J thrust.
Nice work. We want to give one more teaching point here. These back blows are not soft, okay? I'm going to give them one back blow. We want to give them some real power to it, okay? This person's choking. So we don't want to hurt our buddies when we're training, but at the same time, we want people to know that in the actual event of this happening, we are really giving a back blow. Now we're going to talk about what to do if somebody is bleeding. In general, there's two types of bleeds. One is a venous bleed and one is an arterial bleed. A venous bleed will generally be dark red in color and be slower. An arterial bleed will be bright red and can shoot out of the wound. But no matter which one it is, the treatment is the same, and what we recommend is direct pressure. First, as we mentioned at the beginning of this video, your safety is the most important thing. So we always recommend either having a gloved hand, you can use this glove here, or if a glove is not available, we want to use a clean bag. The other thing about direct pressure is we want to get directly onto that wound. So what can happen is, if you have a bulky bandage and somebody's bleeding, if you put it like this and you're not getting directly onto that wound. So it's important that with a gloved hand or with the bag that you get directly on there and put that direct pressure on there. That will stop the bleeding, okay? So this is what it looks like in real life. Person has a bleed. Are you okay?
I need help. I need help.
Call for help. Call for help. Now I've taken care of my own safety first. I have a gloved hand on, or if I didn't have that, I would have a clean bag. I apply direct pressure to the wound, just like this. So here I am. I'm taking the life-saving action that I need to take right now, providing direct pressure to this wound. If this wound continues to bleed here, I can raise it up, especially with an arm or a leg, and I want to keep that above their heart. So by doing that, this will slow down the amount of blood coming to this wound. This is the treatment we recommend. If the bleeding then does stop or slow down, then you can put a bandage on there and wrap it up. But if that doesn't work, what we want to talk about now is the last resort. If they have a wound that's very deep and you're applying this direct pressure, especially to an arm or a leg, but it keeps bleeding, it's bleeding so much and your pressure is not helping, the last thing that we recommend is doing a tourniquet. And what that looks like is you take a cloth or something like this and you're going to wrap this higher than the wound. Sorry, buddy. And I want to wrap this around and tie it really tight, okay? You also want to make note of what time you put this on. But this is a life over limb, life safety technique. So I would tie this super tight as I can. I would also elevate this, and I would want to let the other people who come to help, whether it's a doctor or you get this person to the hospital, and you're going to tell them what time you put this on. So that's the course of action we want to take here. Do you need help? Yes, he needs help. We've called for help, we've sent for help, we've taken care of our own safety with a gloved hand, and we've applied direct pressure. If the direct pressure doesn't work enough, it keeps bleeding, the last resort is the tourniquet. Okay guys, now that we've gone through the basic life safety things and a few of the interventions that you can take, do you have any questions?
So what would be an effective method of treating a snake bite?
Snake bite. That's a good question. I have minimal experience of snake bites, but one thing that I will say is the same principles apply.
Okay.
So main thing we want to do is keep that person calm. Are you okay? Are you okay? I think I was bitten by a snake. Okay, let's call for help. So we've called for help. We don't want to waste any time trying to track down that snake or kill that snake. The focus is on the person who's hurt. So we want to just keep them calm, call for help, and get them to get them either to somebody who can help them or to the hospital. That's good.
What if you lose a finger?
If you lose a finger, that's a great question, actually. If you lose a finger, what we say is the same principles apply. So we're going to put direct pressure on that wound. However, take that finger and put it in a clean bandage and a clean bag, and you can put that on a little bit of ice. And you want to bring that finger to the hospital. And a lot of times they can reattach that. That's a great question.
So what if someone drowns?
If somebody drowns, the same principles will apply to the CPR that we did. Are you okay? Are you okay? No. Call for help. Assess the breathing for 10 seconds. They're not breathing. Start CPR. Now, the only difference is if somebody has drowned, this is a basic course we teach. And again, we always talk about your safety. So we don't recommend mouth to mouth on a stranger. However, if this is a family member or somebody you know, the only thing that we could say that would be different is when you're doing the CPR, you could do 30 reps of CPR on the chest compressions and then do 2 rescue breaths. So it would be 30 and 2, because unlike another cardiac event, it's the drowning, so we could actually put air into their lungs. But that is totally on your comfort level with who is there. So if this is a stranger, we recommend from a safety point of view that you just do the chest compressions. But again, we've called for help and other people will be there. Great question.
How do you deal with burns?
Burns.
If it's like a minor burn.
Yeah. So in general, there's 3 types of burns: first, second, and third degree. So first is like a sunburn, right? Second is more like you can get a blister, right? So if you see a blistering wound, sometimes that pops. Okay, that's a second degree burn. A third degree burn is the deepest level, and you'll see charred, almost white skin. So the treatment is the same, is that we want to apply cool, clean water to take the heat out of that wound. We never want to put ghee or any butter or anything on that. The biggest risk is we want to take the heat out of that, so apply cool water consistently for a long time. We've called for help. We're getting the person to the hospital, but that's the treatment for it. And we want to keep that wound clean, because if you have a second or third degree burn, you might have open skin. So there's a risk for infection. So we want to keep it as clean as possible. Great question.
So how did you guys feel about this course?
That's pretty fun. I like the hands-on experience, one-on-one. That's pretty cool.
I think it was very helpful and something that you never know when you might need to use it. So very helpful.
How about you, Amit? It was nice. Good. And how about you, Parthan? How was it for you?
Yeah, it was great, actually. We had this great group of young men here. It was an absolute pleasure. They were very receptive, and it was a lot of fun to just be able to share a little bit of this and have some fun while we did it. It's been a lot of fun to go over and review these basic life safety emergency techniques that we can use in the event of an emergency. I would encourage you, if you felt encouraged by what you saw here to take more in-depth training through your local emergency services. And maybe one day you could end up in a career where you end up saving lives. Boom! Nice, guys.